Thank you so much, Rev Ford. Appreciate your partnership and all the work you do across the state and on the west side of Chicago. I am not one of the on-the-ground lifesavers that Rep Ford mentioned, but I'm really thrilled to be here. I'm Lindsay LaPointe, state representative from the 19th House District, which is the far northwest side of the city of Chicago. I am the proud chair of the Mental Health and Addiction Committee here in the Illinois House. I am a member of the Health and Human Services Appropriations Committee, and I am a member of the Medicaid Working Group. And I offer up these roles not to say, oh, this is my resume, but because those roles are inextricably linked to the urgent call for the state to step up and start robustly funding evidence-based harm reduction interventions that save lives. And that is what many of us simply call healthcare and behavioral healthcare. With the exception of naloxone and safe supplies, which we are grateful for, harm reduction interventions have been left out of our behavioral health and public health funding streams here in Illinois, and that has to end. And I'm going to say that again because it's really fundamental. With the exception of naloxone and safe supplies, evidence-based harm reduction interventions have been left out of our behavioral health and public health funding streams in Illinois. That has to end. Today, even though I used to be a social worker and a case manager, today I am a state representative and I represent hundreds of people who want to stop using drugs, but they live in fear and stigma and they've never had that soft human touch point to welcome them in, to provide options on how to reduce drug use, or how to use more safely, or how to find a pathway to recovery when they are ready to do so. It is our role as lawmakers who are appalled by this raging opioid crisis to provide those options and those pathways to recover. That is why we are all here today. We're calling for more support for evidence-based harm reduction interventions beyond naloxone and beyond safe supplies. Just last night, I was in a conversation with a federally qualified health center on the northwest side of Chicago because they are here today and yesterday in Springfield. And the leader of that clinic noted to me that they have a medication-assisted treatment program, what we call MAT, M-A-T. But people were not coming into the door to access the program. With a 300% increase in overdose deaths in Cook County from 2015 to 2022, the lack of people at the door of that clinic is not because there is not a need. So I was left thinking, what harm reduction methods could we integrate into that health center to better reach the drug users? How would we pay for it? That's why we're here, to ask and answer those questions. Can we train and send outreach workers into the parks on the northwest side and use behavioral health funding streams to cover it? Can we reimburse nurses for the hard work they do of sitting with someone, walking around the block of the clinic as they build up their motivation to stick with or start MAT? Can we train medical doctors in recovery? Can we train medical doctors on addiction and recovery? Because most doctors have literally no training on addiction and recovery. So the answer to all those questions has to be yes. It has to be yes. And I'm so proud that we have the chair of the Public Health Committee in the Illinois House here with us too. So to be clear, I am proud to be in a state that has a chief behavioral health officer, and we have a public health department that is funding some harm reduction. We're making progress to reflect the reality that behavioral health care is healthcare. That is a good thing. And we're doing all this while we're dealing with a raging workforce shortage. But we have so much more work to do to integrate harm reduction into this work. And it starts with looking beyond naloxone and safe supplies, even though we like that and are very grateful, to truly integrate harm reduction interventions and funding into our larger work of behavioral health and public health interventions. I will leave it at that, and I'm super excited to hear from the lifesavers on the ground.